Now, when you go into, we've spoken about curcumin. That's an obvious one as far as just the color of it, and we could go into the benefits. But what other formulations, what other ingredients are you utilizing within Biosoma?
So normally you can just use for transportation with liposomes. The best things are, like I said, it's like fat lovely substances. So for example, Boswellia serrata, frankincense is a very good anti-inflammatory, reducing pain, directly interacting with our cyclooxygenase system. So it's like the pain relief system, which we are like directly blocking. So normally you just really use fat lovely substances. You can use all the fat lovely vitamins A, E, D, and K, for example. You can use astaxanthin, resveratrol, quercetin, saltstramsins like this. But there are also possibilities to use liposomes, like explained with the example of vitamin C, to use fat water lovely substances. For example, what I could think about are the B vitamins. So they are like water lovely, and normally you just apply them even through intravenous administration, and then they are just taking out immediately what your body cannot take up. So you just want to create like a second pathway or like a depot, which are liposomes also creating, because they are encapsulating the substances. The substance is not directly recognized by our body. So it's like circulating longer in our bloodstream, for example, in liposomes. And then we have a maintenance of blood levels for a longer time than we would have only through administering these vitamins. So there are different uses how you would use liposomes. For fat lovely substances, to dissolving them. For water lovely substances, mostly to attract different pathways or to create depots to have a longer maintenance.
Yeah, it's one of those things that you're taking all these ingredients and you're basically making them supercharged in a way of how they're going to get into the body and create a reaction. And so much of that, as you mentioned, is an anti-inflammatory, right? You're trying to reduce inflammation throughout the body, which is an initiating point of so many diseases. It's the vicious cycle of what's causing inflammation that causes more, that continues on the cycle and then degrades basically the cells around that. Is that the main thing that you would say that you're trying to do, is reduce inflammation and just increase the bioavailability of how the cells are going to utilize the nutrients?
For the most substances, it's about a medical purpose. But there are also substances we can use, like, for example, what we are created in the beginning directly is alpha lipoic acid. It's I would say not like in a typical medical way to use the substances, because it's a catalyzer for the ATP production in our mitochondria. So what we are trying to do is to use it, for example, in muscle recovery or endurance training. So what we see there is that our normal persons, like we are probably, we are not able to create, due to the fact that we are catalyzing by alpha lipoic acid so much ATP production to develop muscle sore. It's not nearly impossible for us. Because muscle sore depends on the ATP values and the possibilities we have in our body to create energy out of our muscles. And once this energy is depleted, we create this muscle sore, because then the acidity in our muscles starts to create. And when you have the possibility to catalyze production of ATP through three different pathways, then you have so much ATP possibility of production that there is no possibility, that it's like nearly no availability. It's like very good available for our body, the ATP production. Then it's catalyzed so much that the muscle sore, it's not coming. And this is what we saw. This is what I'm very much into. For me, it has everything to be like, because I'm educated out of university, it has to be science-based. So what we did through this alpha lipoic acid, we did like 2 patient studies with the sport school in Cologne. It's a very, very famous one in Europe. And they saw through different endurance training that this effect is really happening. And we even had to check it by our doping agency, if this is not for athletes, so much pushing endurance and energy levels and even making them compared to others so much better by taking a substance that could be even considered as doping.
Create ATP, take care of the mitochondria, you have tons of energy to do what you need to recover, to do everything. The body functions better, right?
Yeah.
You went into the research on healthy athletes. Is there any research or evidence on, let's say, ill people that this is helping them to recover?
So for curcumin, there are many uses. So for anti-inflammation, for example, for degradation of cells, it's like very good agent to find degradative cells and to bring them into apoptosis again. So you just help your system finding these cells which are abnormal and to just reduce the amount of the cells. And there are many studies done. And we did also one thing. We did a cellular study for our intestine cells to see and to compare the uptake of like pure curcumin compared to our liposomal formulation. And we are now doing it a little bit further and comparing it even to micellar formulations. So we see like directly the influence of different types of vehicles for our intestine cells. And what we measured is 110-fold higher uptake by liposomes than compared to pure curcumin. By only 75 milligrams of curcumin given.
Well, that's the thing. You're using less and getting more. And that's exactly what the body's about. That's exactly what most people in medicine get wrong. They think more is better. And that's not necessarily true. Again, you could have a lot more vitamin C. If it's not being absorbed by the body, it doesn't matter. It really, you could throw all the milligrams you want at the body. If it's not being absorbed, it's just waste. It's just actually taking energy away from your body, trying to process it when it can't.
Totally right. Totally
right. And that's what people get wrong. Sometimes they think all supplements must work. That is absolutely not true. Sometimes they're counterproductive to what you're trying to do. And a lot of supplements maybe even know that, but just market it well.
Yeah, I give it. Yeah, this is the point. I see also that sometimes substances even can, from a perspective, be a toxicity to your body when they are not dissolved anymore and where they are not dissoluble and they are not like bringing you to a healthier spot. It's like they're making totally the opposite because the formulation is not right and your body cannot interact with them. And then also the concentration of the, I would say, substance which is not dissolved in your intestine grows higher. Maybe your liver cannot handle the elimination of the substances then anymore. And this is where I believe also due to hiring the amount of substances we give. Yeah, we have now with curcumin the thing in Europe that we have to point out that we could have liver toxicity and for example, or bile toxicity or toxicity in our body because the substance itself is like higher to a so big amount to make it somehow work.
Yeah.
It's even not working good, but it's somehow only to work to sell it that you just make the opposite you wanted in the beginning.
And I've seen that before, Matthias, where people, even patients of ours, have gone out and tried other herbal remedies, let's say themselves, and just taken massive amounts and had acute toxicity, and their liver basically almost failed because of it. You don't realize just because it's natural doesn't mean it's only going to give you the good. Every element has a good and a bad to it. And too much of anything could be absolutely bad. And that's, again, where people take this maxim that more is better. And it's not. It's really the quality and the absorption. How little can you get in to make the most? And that's where the body loves it. It's becoming very efficient. Don't throw a lot at it. Throw a little in a way that it knows how to process, and it's going to work better. And you even took it a step further, which I thought was very cool. You did this by Biosomo